Safety and health precaution. When entering the laboratory, we need to pay attention to some existing procedures. This aims to prevent the risk of work accident in the laboratory. It is important and not only concerns the safety of people who enter in the laboratory, but also important for the quality of the laboratory itself. First, before entering the laboratory, we must wear complete personal protective equipment. Among them are lab coats, hand screws, masks, closed shoes, and clear safety goggles or clear safety glass. The purpose of using personal protective equipment is, of course, to protect our bodies from chemicals exposure or microorganisms in the laboratory. Second, ensuring that the work area and equipment in the laboratory are sterile before we start working. The purpose is to optimize the quality of work and samples. If the area and equipment are not sterile, the diagnosis results are not appropriate. To sterilize the work area, we can use lethal liquid. Then, to sterilize the laboratory equipment, we can use laboratory ovens or autoclaves. Third, always be careful of the chemicals in the laboratory by paying attention to MSDS or material safety data sheet and danger signs on reagent bottles. By reading the danger signs on the reagent bottles, we know what treatment we should avoid and what we should do when using the reagent. Fourth, besides using personal protective equipment, people who work in the laboratory must also know laboratory safety equipment. These equipments are very important when an emergency situation occurs as first aid. Among them are eye wash, safety showers, first aid kits, light fire extinguishers, and so on. Last but not least, before leaving the laboratory, we must ensure the cleanliness and neatness of the laboratory. Clean the equipment according to the procedure. Clean the table or work area with lethal liquid so that it is in a sterile condition again. Turn off the power source, put the reagent bottles into its original place, and so on. By doing things according to the procedures when in the laboratory, we can reduce the risk of workplace accidents and support the diagnosis results.